So let's talk about what happens at a pre-op appointment. So when you schedule surgery with a plastic surgeon, you are typically scheduled for a pre-op appointment a week or two before your surgery. So there's a few things that you need to have prepared before that appointment, and I'll tell you a little bit about what you're going to do that day. So the purpose of a pre-op appointment is to make sure that you don't have any additional questions and you know exactly what to expect the day of surgery, and then also how to take care of yourself afterwards. So typically what we'll have you do is come in and you'll get a packet of a bunch of paperwork, and the paperwork is usually your consent package and then a lot of post-op instructions and information where you're going to have to initial and sign. So make sure you come early so you have adequate time to take care of all that paperwork and make sure that you read it and truly understand it. Once you finish your paperwork, like in my practice, we give you little flags so you can flag different pages if you have questions. We spend time with you discussing, again, the procedure, day of surgery, after surgery, things about the procedure, but also nuts and bolts things like when should my friend be there to pick me up? How long do I need to take off of work? You know, things that you may not remember from your consult. Sometimes patients have consults many months before their actual procedure and they don't remember some things. So the other thing you're going to need to have that day is whatever pre-op lab work, imaging, and visits available for your surgeon to see. So prior to any procedure, you're going to need to have some sort of pre-op evaluation. So sometimes we'll just order labs for you and we don't require you to see anybody. Sometimes you need to see many people. You need to see a cardiologist or a hematologist. It's just going to vary depending on your age, medical problems, and why you're having the surgery. It's really important that all of that information is done and available for your surgeon at the time of the pre-op appointment so we can adjust things as needed depending on what we find in all of those studies. So it's a really important appointment, and a lot of people think it's just meant to go pay the rest of your balance and to fill your paperwork out, but it's really a good opportunity to make sure that you and your surgeon are on the same page, that you're comfortable with what's going to happen the day of surgery, and also that you have good expectations for what it's going to be like during recovery and you're able to get help if you need it. I always make sure my patients know how to get a hold of me or people in my office. Those are important things to ask at your pre-op appointment too, if your surgeon doesn't just give you that information. And then if you're going to do a procedure with pathology, I think it's always important to ask in the geographic location and the facility your surgeon works at how long pathology usually comes back, and then who is going to call me and give me that information. So important things to know. Pre-op appointments are really underappreciated, I think, by many people, but they're one of the most important appointments I have with patients.